short.
Yeah, they're pretty low.
Well, they are kind of. Right, they're very low.
Yeah. They're Corvette seats.
They are. Okay. All right. Good morning. I am Sedgwick County Health Department Director Adrienne Byrne. Yesterday, our governor issued a state of emergency, and this allows Kansas access to resources more readily. Now, Sedgwick County Board of County Commissioners serve as our Board of Health for Sedgwick County, and we have a health officer, Dr. Menz, that also is our health officer for Sedgwick County. Today, they're going to be talking about actions taken as our Board of Health and our health officer. So COVID-19 continues to evolve quickly. We currently do not have any Sedgwick County residents who are positive for COVID-19. This will change, but as of now, we do not have any Sedgwick County residents who are positive for COVID-19. The health department, we are in regular contact with the Center for Disease Control and also our state health department, Kansas Department of Health and Environment. And our goal is to keep Sedgwick County residents as safe as possible. And we are working to keep you as informed as possible as when we get information about Kansas and Sedgwick County, we are ensuring that we share that information with you so that you know what is going on. So with me this morning is Dr. Menz, and he is our health officer. He's also the Dean of KU School of Medicine and an infectious disease doctor, and he's going to talk about restrictions in Sedgwick County. And Chairman Meisner is here and will talk about, among other things, effects on Sedgwick County. Dr. Menz?
Thank you. Yes, I'm Dr. Gerald Menz, and I'm the local health officer for Sedgwick County and for the health department. In response to growing public health concerns related to COVID-19 threat, we at the Sedgwick County Health Department are announcing that, until further notice, there is a ban on public gatherings with more than 250 attendees in Sedgwick County. The prohibition includes the Bare Knuckle Fighting Championship 11, which was scheduled for Interest Bank Arena this Saturday. This event has been postponed until June 20th. Under state statute, the local health officer has the authority to cancel public events when there is a broad public health concern. Out of an abundance of caution, the prohibition of large public events is necessary to help keep our community safe and healthy, especially vulnerable populations. As we continue to learn more about COVID-19, we will revisit these recommendations and adjust as necessary. I want to remind the public that Sedgwick County residents are at low risk for infection currently from COVID-19. The illness is likely to spread by droplets from an infected person's nose or mouth through coughing, sneezing, or touching their face with their hands. Thank you.
Good morning, everybody. Thank you for being here. This is clearly an item that is an area that we have not been in before. It's an area the country has not been in for years. I just want to assure the public that our federal officers, our federal Congress, working with CDC, is in constant communication to every state, including ours in Topeka, with KDHE, the governor, and there it comes down to the Sedgwick County Board of Health, which part of our elected officers as commissioners serve as the Board of Health. So that's part of our duty, and part of that is we contract with a health official, a doctor, which has been Dr. Menz,
and he serves with authority under statutes to issue various items as he determines. So with that, after much discussion, he just announced the 250 public gatherings ban until further notice. But we got to all understand that we are responsible ourselves for gathering the information, keeping home if you need to, watch your travel, all the logical things that come with something like this. But these experts are diligently working hourly. I'm reminded that yesterday I was in a press conference with the Mayor Whipple, and in the middle of it, we were talking about we'll see what happens, and it was pointed out 5 minutes into the press conference that we didn't even know that like the AAC basketball tournament was canceled. So stuff is happening very fast. We will schedule to keep updates every week at the commission meeting, but it's likely that news that affects our local area, Sedgwick County, can be happening by the hour. And so with that, I just want to ask that everybody stay calm. We're all right. Sedgwick County's not affected yet, a resident. And with that, I'll hand it back to Adrian.
So going forward, the health department will continue issuing regular updates on our website. We have a fact sheet. We have questions that people are asking that we're answering. And so those updates will feature any information about COVID-19 that are occurring in Sedgwick County and in Kansas, best practices to protect the health of everyone in the community. That is our goal again. And as the director of the health department, I will be weekly starting the Board of County Commissioner as our Board of Health, also giving updates on what has occurred in Kansas and in our community. Thank you.
Dr. Mims, I think it's worth explaining the regional medical affiliation so the public can understand.
Yes, as we mentioned, we do not have a Sedgwick County resident that we know of that is infected this time. However, our hospitals, both Wesley Medical Center and Via Christi Ascension, serve as regional referral centers for much of the state of Kansas. And therefore, we have a number of critically ill patients that are commonly referred here for care. So it's very likely we will have patients in one of those two facilities that do have the infection that they're providing care for. So there are cases in Kansas, yes there are, and it's possible that some of them could be referred here.
And I think the regional coverage, Sedgwick County is 500,000 residents, but the hospitals cover regionally up to about 1 million of the surrounding counties.
Yeah, approximately 1 million or so.
About 1 million.
Much of western Kansas and obviously south central Kansas, northern Oklahoma, much of central northern Kansas. So.
Okay, thanks for clarifying.
Yes, since we know, what we know today is that COVID-19 is spread through droplets, through someone sneezing, coughing, and then landing on a surface. It's very important to wash the hands thoroughly, and 20 seconds seems really quick until you're washing your hands for 20 seconds, but ensure that people are washing their hands, all of us, for 20 seconds. And then the real challenge is to keep our fingers away from our eyes, our nose, and our mouth. Don't share utensils or cups, and stay home if someone is ill. Try to stay away from sick people. And these are important things that we do all the time. It's just even more important when right now, as we know, when we have this novel virus in our community.
And I would add, since the hands are often the method of transmission, that probably shaking hands ought to be curtailed for the time being. And so no one should feel offended if you don't shake their hands.
Right, and Dr. Mims, can I ask you to scoot your microphone a little bit closer to your face and we can start with some questions? Okay.
Is this ban applying to restaurants and stores, or are you talking about, okay, parades, like St. Patrick's Day parade tomorrow?
Yes,
That one was just canceled.
it applies to large gatherings of people, lots of people together. I wouldn't count the number of people in a grocery store at one time and say that they have to count the people. I don't consider that a mass gathering. People aren't there sitting next to each other and mingling with each other.
And this, just to clarify, this is a ban or a recommendation?
It's a ban.
And what about churches?
At this time, it applies to 250.
So that includes churches?
Yes.
And you're telling them they're going to cancel services?
Limit to 250.
They can have less than 250.
How is this ban enforced?
Well, we're hoping the public will hear this news. I think the public is paying hourly attention themselves on everything. We're a good community, and we're not one that is one to be too radical. And we're hoping that the community will be responsible and play their role.
And these things are for prevention. These are preventative measures.
Yeah, we want to emphasize this. This is not because we have an epidemic occurring right now in Sedgwick County. We're trying to prevent that. And I think our community will understand this is the way we keep it from becoming that. I think they will also realize from all the other things that have been canceled, things very important to our culture, that this is a very important issue. That will certainly be something we reconsider every day, every week. Many of the schools are going on spring break next week, and we will have to reevaluate at the end of that week.
What would this ban mean for high school graduations?
I can tell you higher education as well as high schools, I think we'll have to reconsider that depending on the situation at the time those graduations will be occurring, but it's too soon to say about that at this point. I don't have any direct knowledge of that. Anything I would say about the case at Wesley would be speculation on my part.
Yeah, you said there's no cases in Sedgwick County, but this morning we heard the patient in Wesley.
No Sedgwick County resident.
Okay, but, so, you do know that it's not a Sedgwick County resident? Do you know any more
No.
information, or would it be speculation?
So who's in charge of the messaging on it then?
In charge of the messaging to the county about what is occurring in Sedgwick County, I am.
So there is a patient in Sedgwick County right now. They're not a resident up here, so where are they from?
When that information is released, that will be the county that that resident is in to release. What we are reporting at this time is what we know to be the case that we have been told as far as other areas. But I can tell you, we can tell you that there is not a Sedgwick County resident that has been diagnosed with COVID-19 at the moment. If someone is in our hospital, as we know that we have many communities that are using our hospitals, and someone would be a contact of someone there that was a Sedgwick County resident, then we would be involved in that investigation.
More questions? Can we go back to what this ban means for people? So what about public school districts?
Well, as Dr. Menz had said, currently they're on spring break, and things are changing so rapidly with COVID-19 in our state that it will be reevaluated next week, if not before, depending upon what happens, as it's something new is every day.
Do you believe the Sedgwick County is, or the state of Kansas is still kind of ahead of the curve of infection to be able to keep control of it before it ramps up even more?
Exactly. There are some states in the United States that have had a lot of cases and a lot of transmission going on. We hope to do what we can to prevent that from happening in Kansas and in Sedgwick County.
Is there a reason for the 250 number versus saying like 150, which
It's a number. It's something we decided to go with as our first try. But no, there's no scientific evidence about what the critical number is. I don't know that anyone has that number.
Talk a little bit about test kits, where people get tested. I understand that there are 2 private labs that just work for testing. Can you talk a little bit about how not everyone needs to rush and get tested because there is a limited number of test kits?
Well, and it's important to remember that since COVID-19 is not in our community yet and is not community spread, that the criteria for who is to be tested has not changed. And that criteria is if someone has traveled to one of the level 3 countries, and if they haven't traveled to one of those countries, if they have been a close contact of someone who has tested positive for COVID-19 and is symptomatic. So if a resident were to call their physician or to go into a clinic or the health department, they would have to say yes in order to be recommended for them to be tested at this point.
And that's subject to change as the whole epidemic evolves.
That is evolving with the COVID-19, but currently with it not in our community and is not widespread, the hospitals are aware of how many beds that they have available daily. Resources are an issue all over the country. And we are aware of how many we need and will be putting in an order today. And we do have a lot of those available to us at this time. The issue is ongoing.
Okay, any closing comments?
Thank you for being here today, and know that we are in constant contact with the Center for Disease Control and our state health department, Kansas Department of Health and Environment, and our goal is to share information with you as we get it. And we wouldn't share information about another county before they made the announcement in their own county. But once that information is there and we have it, then we will share the information that we have with you.
And I'd like to add, there is no need for panic. Kansas has no case that we know of that was transmitted in Kansas. We're doing this trying to keep the status here, trying to keep active cases developing here in Kansas. So this is prevention.
And I would add that as a county commissioner, our board is highly supports the recommendation of our local health experts. Last I checked, I don't think any of us had a MD behind our names. So we are burdened with being the Board of Health and relying tremendously on our recommendations that as they receive from KDHE and CDC, they're in constant contact, and we are all eager to always share whatever we can. There's nothing to hide here. We just want to share the facts so everybody can know that they're working from the facts and try to remain calm with everything, as Dr. Min said. So thank you as well.
Thank you all for being here this morning, and as we know more, we can share it through all of our avenues as well.
Thank you.